Assalamu alaikum. As we've completed the muscles, now we have some structures, neurovascular structures that I'd just like to go through. First of all, we have the common iliac artery and common iliac vein. Then both of them divide into internal and external branches, internal iliac artery and external iliac artery. Then internal iliac vein and external iliac vein. Right next to it you have the lumbosacral trunk and the sacral plexus. Here we have the obturator artery and obturator nerve. So this is the iliacus muscle, psoas muscle, both of them combine to form the iliopsoas muscle. Okay, so next we have the femoral neurovascular bundle, femoral nerve, the most lateral one, femoral artery in the middle, and the femoral nerve, artery and vein. If we take it from medial to lateral, so van. So these femoral vessels will travel downward. This is the intermuscular septum, anterior medial intermuscular septum. And from here you can see they are moving towards the back. So at the upper portion they were in the front, and now they are moving towards the back. Here you can see, so the femoral vessels are now the popliteal vessels. So this is the popliteal artery, popliteal vein, and this is the sciatic nerve passing through the popliteal fossa. So now I'd like to go a little bit up and describe these vessels right here. So the superior gluteal nerve and the superior gluteal artery, superior gluteal nerve and artery, posterior cutaneous femoral nerve, posterior cutaneous femoral nerve. Here we have the pudendal nerve and the internal pudendal artery, pudendal nerve and the internal pudendal artery, and these are the inferior gluteal nerve and artery. This one you have the sciatic nerve, the large one. So 1, 2, 3, 4 and 5 nerves. So this is again sciatic nerve going downward. So at this point, this is the sciatic nerve. I've removed the superior muscles, gastrocnemius and soleus. So this sciatic nerve is dividing into tibial nerve. So this is the tibial nerve now, and this is the posterior tibial artery, tibial nerve and posterior tibial artery. Now that I've turned the leg, you can clearly see this is the deep peroneal nerve. This one is the deep peroneal nerve along with the anterior tibial artery. So deep peroneal nerve, anterior tibial artery. On the posterior side you had the tibial nerve, and this is the fibular or the peroneal nerve, and then you have the anterior tibial artery. This anterior tibial artery enters into the foot and continues as the dorsalis pedis artery. This is the dorsalis pedis artery. So anterior tibial and after passing through the retinaculum, dorsalis pedis artery. And this nerve right here, it is the medial branch of deep peroneal nerve. Sorry, the medial branch of deep peroneal nerve. Okay, so now this is the plantar surface of the foot. You have the lateral plantar nerve. This is the lateral plantar nerve, and right next to it you have the lateral plantar artery. So this is the lateral plantar nerve and the lateral plantar artery. Then medial plantar nerve, and so this structure, this arch formed by the blood vessel, this is the plantar arterial arch. This is the plantar arterial arch, and if you see here clearly, this is the common plantar digital nerves. So common plantar digital nerve, and it divides into proper plantar digital nerves. So common plantar digital nerve, it divides into two proper digital nerves. And here you can see this is the common plantar digital artery, which further divides into common plantar digital proper plantar digital arteries. So common is always divided into proper. So these were some of the blood vessels that were and nerves visible on the model. I hope you found this helpful. Thank you.